course, in Cape Town, we are joined through Zoom or Skype. You can choose whatever you want to choose, by Minister Dilil. Minister Dilil, are you on Skype or Zoom?
On Skype.
Thank you very much.
Skype, Minister.
Thank you very much, Minister. We appreciate that we have many people awaiting this briefing of the economic transformation cluster in our government. Without any further ado, maybe let's start with Cape Town. Let's start with you, Minister Dilil, so that you tell us what is your readiness for level 3 and what can we expect in your toolbox in the fight against coronavirus. Minister Dilil.
Thank you, Minister Mthembu, and good afternoon to the media, South Africans, and my colleagues. The Department of Public Works will provide you with an update on state of readiness with the number of quarantine sites available with the start of the level 3 regulations on the 1st of June. As it's been just over 2 months since the national lockdown started, and in order to contain and curb the spread of COVID-19 virus, as part of government's response to address the pandemic, various departments had various roles and mandates to fulfill to safely navigate our country through the difficult and trying times. In terms of the regulations, the Department of Public Works and Infrastructure's role is to identify and make quarantine sites available, and for the Department of Health to assess and confirms a facility as a quarantine site to meet the health standard. And once a facility has been confirmed as a quarantine site, the Department of Health will then make it operational, and the site will be activated and procured by the Department of Public Works and Infrastructure. So our task, therefore, is to identify quarantine sites in all 44 districts and the 8 metropolitans. We have also engaged with the provincial departments of public works, with the various municipalities in all the 44 districts and metros, to also make available sites for quarantine purposes. As level 3 starts on Monday, the 1st of June, we would like to update on the DPWI's state of readiness with quarantine sites, as the infection rate is expected to increase with millions of people returning to work on Monday. So DPWI has been working on all fronts over the past 2 months to ensure that we are ready for all eventualities and the worst case scenario by having enough quarantine facilities available as the need arises, and should the number of people who need to be quarantined increase dramatically. The Department of Public Works and Infrastructure has also approached the private sector, especially the hospitality industry, to make available some of their facilities for quarantine sites, since they didn't have any guests during the lockdown. And I want to thank the private sector for all the offers that they've made to government. We have so far identified 1,751 facilities, representing about 129,600 beds across the country. And of the 1,751 facilities, 642 are state-owned and 1,109 are privately owned. In the Western Cape, for example, which is currently the epicenter of COVID-19 in our country, there are 358 facilities that have been identified, representing 27,500 beds. Some of these facilities have been assessed by the Department of Health and confirmed as compliant. And nationally, 395 facilities have been assessed by the Department of Health, representing more than 35,700 beds. And in addition to state-owned and private facilities, there are also sites from state-owned enterprises, such as Transnet and Eskom facilities. And these sites have been assessed by the Department of Health and activated by the state-owned entities. The public sector sites that have been activated and set up by government, these public sites are being managed and by government and also by the respective provincial government. Now, with these numbers, we can assure South Africans that the Department of Public Works and Infrastructure state of readiness, that we have enough quarantine facilities available as the need arises, an expected increase in infections and also more people being repatriated. So far, we have repatriated just over 10,000 South Africans from all over the world. And all of them, as they arrive in our country, they are put in a mandatory quarantine period for 14 days by the Department of Health. There's also some work underway by the Provincial Public Works Department in relation to field hospitals. In the Eastern Cape, 32 hospitals have been identified for refurbishment. In KwaZulu-Natal, 19 hospitals are being refurbished. In Mpumalanga, 10 sites have been identified for field hospitals, and the province is currently busy with technical assessments. In the Western Cape, the Convention Centre has been completed as a field hospital site, and other sites have been identified and are being considered to be converted into field hospitals. In the Northwest, the teams are focusing on augmenting the capacity of existing hospitals by constructing additional structures. The remaining provinces are still in the process of finalizing their plans for field hospitals. We are committed to continue our task and do all that we can to keep South Africans safe and to do all that we can to curb the spread of the virus. Thank you, Minister Mthembu. That is my submission.
Thank you very much, Minister Delil. We will now continue to have some more inputs on government's readiness. Having concluded with Minister Delil, we are now proceeding to Minister Mantashe, who will come here. Now, I don't see myself on the monitor, which means that I won't see, South Africa won't see Minister Mantashe. We are still seeing Minister Delil on the monitor. Are we okay? Minister Mantashe?
Should I start?
Just give us a moment. We're trying to see if we can get the link with Minister Delil changed.
Yeah?
Oh, yes.
And do you can forget it?
Yes, I'm continuing. Yes, I'm continuing. Linda.
Until what happens?
Oh, but it Kubango. Kubango. But it
Kuba. Cool. Okay.
I'm listening to you. Can you go on?
Okay. Thank you, Minister Mthembu, who is in charge of the session, cabinet colleagues, Minister Delil, Minister Patel and Minister Ngesi, members of the media, officials from the various departments. President Cyril Matamela Ramaphosa announced that South Africa will move to alert level 3 of the nationwide lockdown. This will open up the economy and remove several restrictions while government significantly expands and intensifies public health intervention. Our department, the Department of Mineral Resources and Energy, has been engaged in continuous discussion with stakeholders in mining and energy portfolios to ensure that our collective intervention save lives and protect livelihoods. We're going through a very difficult period. We are called upon to learn to live with COVID-19. We need to grow the economy while at the same time we save lives. In our view, energy will be the flywheel of reviving our economy, which has been severely impacted upon by downgrade to junk status, recession, and COVID-19, because a combination of the three is what impacts on the economy. The measures that we have taken have been developed in line with the call by the President for government to consult and implement a risk-based strategy that will enable a phased recovery of the economy. Let me talk briefly about the energy. To ensure security of energy supply to society, collieries that supply Eskom continues to operate at full capacity during the lockdown. During alert level 5 of the lockdown, we allowed refineries to continue operating at full capacity to avoid shortage of fuel. At the time, demand had collapsed due to closing of the economy. As a result, 4 refineries were temporarily closed. With the gradual opening of the economy and the rush in preparation for level 3, the demand increased sharply, resulting in low stocks of diesel. It is expected that diesel will be rationed to meet the demand until the end of May, when refineries that were closed will start producing. The department issued directions to provide continuous supply of energy and petroleum products by allowing maintenance and construction work for energy projects to resume under strict health and safety protocols. These directions apply to professional entities that provide licenses, approvals, and authorizations for the maintenance and construction of energy projects. All professional planning, costing, and design work that supports construction work on sites, contractors and consultants who need to travel across borders to attend to projects and energy construction work already priced and awarded government tenders are allowed to travel. To give effect to SONA 2020 commitments and ensure security of energy supply, we have implemented all the resolutions that were announced. I can expand on them when there are questions. In mining, under level 5, collieries that supply ESCOM and oil refineries were allowed to operate at full capacity. This was extended to open cast mines under alert level 4. Under alert level 3, all deep mine operations are expected to ramp up to full capacity. This brings mining to full capacity of production. All mining operations must prioritize health and safety of mine workers and other persons who may be directly affected by the operation of the mines. Compliance with conditions to the starting and increasing of capacity as enshrined in the lockdown regulation is compulsory. Prior to ramping up, all mining operations are required to prepare and implement mandatory code of practice for the mitigation of management of COVID-19. Failure to do so will be regarded as criminal offense and a breach of Mining Health and Safety Act. We believe that the directive to all mining operations to ensure safe startup procedures and the systematic phasing in of workers will allow the sector to operate safely. The department continues to monitor compliance through regular, unannounced, and scheduled visits to the mining operation. Following unannounced visits, we discovered that not all operations are at the same level of compliance. Most of them were doing well up to the screening, but lagging on testing. Once we made that discovery, we gave the feedback to the Mineral Council of South Africa and insisting on improving on testing. Our insistence on testing and screening of all persons on the mine has enabled us to detect the virus in various mining areas. As of Thursday, 28 May 2020, the mining industry had tested over 4,600 persons at mines, of which 384 tested COVID-19 positive. Let me repeat the number. 384 as of yesterday tested COVID-19 positive. This means that Of the 27,433 cases in South Africa, 384 are in mining. The more we test, the more we become aware of the extent of the problem and the location thereof. The new complication that is emerging is people who show no signs of COVID-19 but testing positive. This tells us that we need to intensify our screening and testing program. We urge all mining operations to pool their resources together and share testing and quarantine facilities. Wherein there is non-compliance to the regulation and a threat to the health and safety of any person at mines, the department will not hesitate to issue instructions as guided by mine health and safety, including closing an operation. We want to express our appreciation for the support we are getting from MECs of health in all the province up to now. We wish to express our condolences to families of those who succumbed to COVID-19. We wish those who have tested positive a speedy recovery. Thank you very much.
Thank you, Minister Mantashe. We will now give an opportunity to the Minister of Labour and Employment, Minister Nxesi, to speak to the nation. Minister.